two therapy updates that have both come about in the last few weeks and are interesting in and of themselves and indicative of where we are in hemophilia drug development. So the first from Pfizer, there is now an FDA-approved subcutaneous treatment called
Hemophilia.
We're not 100%, but we believe it's Hemophilia for routine prophylaxis to prevent or reduce the frequency of bleeding episodes in adults and pediatric patients aged 12 and older, adolescents.
But here's the kicker.
With hemophilia A without factor VIII inhibitors or hemophilia B without factor VIII inhibitors. This is a once-weekly subcutaneous treatment, and it's the first to be administered via a pre-filled pen or syringe for eligible people living with hemophilia A or B.
Is this the first treatment for A or B that's been FDA approved?
Of this tissue factor pathway inhibitor variety?
I think so, but nothing else works for hemophilia A and B that's
see.
FDA approved.
Yes,
right? Okay.
as best, yes, that is correct. This is the first one that is approved for either A or B.
So we're all in this together.
Without inhibitors, and we're all in this together.
To quote High School Musical.
It's also the first that is administered with this pre-filled pen.
Yeah.
So it's just coming ready to go. The target for this therapy is this thing called tissue factor pathway inhibitor. That is a natural anticoagulant protein, and its function is to prevent the formation of blood clots and to restore hemostasis. So we talk a lot about the desire to form a blood clot because when someone has hemophilia or a bleeding disorder, they're missing a protein that results in bleeding. However, the other side of the hemostatic system is the ability to stop blood clots from forming, because otherwise we would overclot. So there's basically a system of checks and balances within the coagulation cascade.
Which is in our body naturally, which is so cool.
Yeah.
Because if you think about it, the clotting cascade produces, a bunch of proteins. Like there's all these chemical reactions that happen when our body has an injury, and they just keep producing. And if we didn't have anticoagulants to kind of like level that out, all of us would overclot. Like our body wouldn't know when to stop. So our body has this natural checks and balances system, which is so cool. And science now, if you're a nerd about the science fair, like I am, we go into some of this stuff to try to teach these really complex ideas kind of in a hopefully like a digestible way, a fun way. But it's so cool how our body naturally balances itself. And these new treatments are fascinating because they are utilizing the entire clotting cascade and turning, to figure out like where we can modify, manipulate, just curve around to help us form adequate blood clots. So.
And while we've seen gene therapies before that, we saw the first MAB, emicizumab, a mimetic.
Love a MAB.
Love a good MAB.
I take a MAB for my migraines.
You love being part of the MAB club.
I do.
How's it going, by the way?
It's so great.
In a while.
My bleeders.
How's your MAB?
No, bleeders. The other day we were like, my Sharps container's getting full, and I was like, yes.
Yep.
Gonna have to get a second Sharps container, bleeders.
So relatable. So crazy relatable. So what's different, though, now is we have treatments that are targeting this anticoagulant part of the coagulation cascade. So we had factor replacement. Then we had the first mimetic, something that is designed to mimic the function of factor VIII in the coagulation cascade. Then gene therapy, which is still about the production of factor VIII proteins, ultimately, or factor IX proteins. Well, now we are seeing these therapies that are targeting the anticoagulating part of the cascade. So that's the first one from Pfizer called Hemophilia.
Yeah. I think that's right. I think you nailed it.
Thank you. I hope so. Also worth noting, it has received positive reviews from the Committee for Medicinal Products for Human Use of the European Medicines Agency, or the CHMP of the EMA, if you're an acronym fan. That's essentially the Europe equivalent of the FDA. Now, there's a second tissue factor pathway inhibitor targeting therapy that's also in late investigation approval stage. Now, this one's led by Novo Nordisk, and it's known as concizumab. This is also available for patients with hemophilia A or B without inhibitors, and it has just received a positive recommendation from the EMA's CHMP. Notably, however, last year concizumab filed with the FDA here in the United States but was rejected, with the FDA requesting additional information around specifically proposed monitoring and dosing. The drug has since been approved in Canada, Australia, Switzerland, and Japan, and now has received this positive indication from Europe. It's also worth mentioning that concizumab has been refiled with the FDA. So the bottom line, this is news just in the last few weeks. Science is continuing to innovate the ways in which we can overcome deficiencies or dysfunction within the coagulation cascade. I think in the last year on the hemophilia A side of things anyway, we've seen the first gene therapy come to market, not necessarily the therapy we were all hoping for. I think it's exciting to hear about these things that have been working in the background all the while that are now ready to come out and that may be the right treatment options for certain people. And I think a lot of folks don't realize how much has been going on because gene therapy has gotten so much attention. These rebalancing agents really haven't received the same amount of, airtime, so to speak. But as these recent approvals indicate, we're kind of ramping up in that new product class of therapies.
I agree. And just to make one small, not small, this is like a massive comment, but I do want to say that I need to go back. I should have come in prepared to see if any of these clinical trials included women in these trials, but it remains to be seen. I think how some of these new therapies will work with a woman's body, with our different hormones. It is an exciting time with all of these new therapies that we get to choose what works best for us and our bleeding proficiencies and, how we want to live our life, the activities that we want to do. But I guess I'll just, state that for the record that we still have a lot of work to do in terms of like inclusivity in our community.
To put it mildly.